So for our skills check, we are working with our 65-year-old patient named Bruce Wayne, and he is presenting to physical therapy with complaints of low back pain with an insidious onset. He notes that the pain is primarily on the right side of his lower back and radiates slightly into his right buttock with prolonged standing and walking, with pain easing immediately when he sits down.
He also reports difficulty with squatting and lifting heavy objects off the ground, causing difficulty with his hobby of working on his Batmobile. He has decreased lumbar extension range of motion with pain. Pain is improved with lumbar flexion. He demonstrates 3 out of 5 trunk flexor and extensor strength and a 4 out of 5 gross hip strength. And upon observation of the standing posture, we've noted that he has decreased lumbar lordosis and poor pelvic control during squatting. Okay, so for Bruce Wayne's beginning exercise, what I'm going to have him do is pelvic tilts, doing them anterior and posterior. And since he has decreased lumbar extension, this will help increase his extension. And since he has pain, this is a good exercise to where it won't push him into too much pain, and just take that into consideration. So for this, what I'm going to have Bruce do is 3 sets of 10, doing 10 anterior, 10 posterior, doing it 2 to 3 times a day or as needed, and then doing it every day. And then to progress this, if it's too easy, I'm going to have him do pelvic tilts with bridges. So now I'm going to teach Bruce how to do the pelvic tilts. So to go into a posterior pelvic tilt, I'm going to place my hand here, and what I want you to do is just push your back down into my hand. Good. And then come back up. And when you come back up, what I want you to do is kind of bring your chest up and push your butt down into the table. So we'll go down again. That would be posterior and then anterior. Posterior, anterior.
To start off Bruce Wayne's exercise program, we're going to start off with some Supermans. What do you think of the name? So for the Supermans, what we're going to do is do 2 sets of 10 and repeat this 2 to 3 times daily to help increase his lumbar extension range of motion, since it is restricted. And when doing this, we don't want to go to the point where we're invoking too much pain, so we can change this based on his daily subjective and see how he's feeling. And for this, we're working on motor recruitment of his lumbar extensors. So Bruce, what I'm going to have you do is stick your arms out up front, okay? And so what we're going to do is I want you to squeeze these muscles right where I'm palpating when you come up. Perfect. And then to increase this, we can also lift the legs off the table. So why don't you try that real quick? Good. How does that feel? Good. Good. All right, you can stop. So by palpating, we're giving him some tactile cues on where he should be contracting his muscles to work on that motor recruitment to improve his lumbar extension. And to progress this, we can do some ITs and Ys on the ball later on in the program.
Okay, so for the middle of the exercise program, what I'm going to have Bruce here do is crunches on a ball. So it's just a little bit easier since he does have some reduced trunk flexion strength, and then he still has reduced extension, so this will help work on his extension range of motion and increasing that strength. So for this, I'm going to have Bruce do about 1 set, 10 times, 10 reps, and then he'll be doing this about 5 times a day and just trying to do it daily to help increase range of motion and strength. And then to progress this, what I'll have Bruce do is either do it on the ground or he will just add weight while doing it. So now I'm going to demonstrate or teach Bruce how to do the crunches. So I have Bruce set up here. He's on the ball, kind of in a squat position. And for this, in a seating position, his trunk is in flexion, so it does help reduce his pain. And then we want him to go into this to have slight pain, but not pushed into too much pain. So for this, I'm going to have you cross your arms, and then you want to keep your feet stable. You don't want them moving. And all I want you to do is just roll your spine back onto the ball and then come up. And as you're coming up, I want you to use, you can go back down, rolling slowly, and I want you to activate your core muscles here, using that to pull you up. Good.
For the middle part of Bruce's exercise program, we're going to be working on sit to stands. So Bruce is 65 years old, so we need to work on his stability and motor control when doing this daily functional activity. So for this exercise program, we're going to do 20 reps, and we're going to do it 3 times a day and doing it every day, and this will help work on building that strength and control. So I'm going to teach Bruce how to do this appropriately, and this also will help move into squatting, which is an exercise that will be a part of Bruce's program later on. So Bruce, what we're going to do is I am going to have you Scoot forward to the edge of the chair, holding onto the edge as best you can. I want you to bring your feet underneath you just a little bit. And when you sit up, I want you to lean forward over your legs slightly, but not too far, and really work on squeezing those glutes and pushing through your legs when you stand, okay? And I'll be here to guard you as needed. So whenever you're ready, just push off. Perfect. And now I want you to reach back with your hands and slowly lower down. Good. Back up. And like I said, we would do this 20 times and do this 3 times daily.
Okay, so for the end stage of Bruce's exercise program, what we're going to be having him do is squats with a kettlebell. So this is a more functional exercise because Bruce does have to lift heavy car parts off the ground when he's working on his Batmobile. So for this exercise is working on his strength, motor control, balance, and coordination, just an overall good exercise. And for this, I want Bruce to do about 8 reps, 3 sets, doing it 4 to 5 times a week just to help increase his overall strength. So first I'm going to demonstrate. So what I want Bruce to do is have shoulder width apart feet, and then what we're going to be doing is grabbing this kettlebell, and we want to go holding it close to our body, taking it all the way down, having it touch the ground. You don't want your knees to go in or out. You want them to stay very neutral. And then for this, Bruce's knees can go slightly over his toes just to make it more functional. And for this, we want him to keep his back straight. We don't want him bending, making sure that when you come up, you're tightening your glutes, tighten your hamstrings so that it's not putting too much pressure on his lower back.
For the end stage of our exercise progression for Bruce Wayne, to help him return to function, we're going to be focusing on doing some Romanian deadlifts. This will help him get back to working on his Batmobile, which involves a lot of forward bending and going inside the engine. So what we're going to do is start with 30 pounds, and with Bruce, since he's 65, we can progress the weight up more if we need to. And we'll start with 3 sets of 8, and we'll do it every day. And now I'm going to show Bruce how to do the exercise. So Bruce, to do a Romanian deadlift, what we're going to start with is we're going to keep our feet shoulder width apart, bend over, pick the weight up. So we're going to start up here. So when we go down, we want to make sure we don't arch our back forward or droop our shoulders. So try to keep a good upright posture. And when we go down, try and push through your butt and through the back of your legs. You should feel a nice pull in your hamstrings because we're working on those glutes and the hamstrings for your hip extensors. So when we come back up, we're going to thrust through, okay? All right, here you go. Good, you feel it through the back of your legs? Yep, awesome. So working on these hip extensors will help with strength and endurance for Bruce so that he can return to function.